Hello, Mr. Kwansi. This is Mr. Chiu. I'm calling you to remind you that you should not be performing any exercising tomorrow, and you should not have any alcohol, caffeine, food, or tobacco 3 hours prior to testing. Okay? Yeah. So remember your attire and to drink plenty of water. Okay? All right. See you tomorrow. Yeah, hello, Kwansi. I'm Mr. Chiu. Today we are going to perform a 20-meter multi-stage fitness beat test. So ideally, we'll be doing a VO2 max on a cycle ergometer. However, I do not have the access to the equipment and the staff needed. So this test will assess your cardiovascular fitness by estimating your VO2 max. VO2 max being the amount of oxygen your muscles are able to uptake during exercise. Basically, it's an important metric in determining your cardiovascular fitness. So before we begin, are you feeling well? Okay, so if anytime during the test, if you feel unwell, do let me know so that I can stop the test, alright? Okay, so do note, for all exertional fitness assessments, if you have any of these symptoms, the test will be terminated. So, onset of angina or angina-like symptoms, significant drop of systolic blood pressure over 20 mmHg, or systolic blood pressure fails to rise with increased exercise intensity. Excessive rise in blood pressure, systolic blood pressure increasing over 260 mmHg, or diastolic blood pressure increasing over 115 mmHg. Signs of poor perfusion, lightheadedness, confusion, ectalia, pallor, cyanosis, nausea, or cold and clammy skin. Failure of heart rate to increase with increased exercise intensity, changes in heart rhythm, you request to stop, physical or verbal manifestations of severe fatigue, or the failure of testing equipment. Okay, so to reiterate from our previous meeting as my client, you must fully understand and be aware that number one, you are volunteering to participate. You also have responsibilities in informing us of any problems that you may be experiencing. You're free to withdraw from participation at any time with no consequences. You're allowed a Q&A session with me. You should know that the benefits of this assessment is that I'm able to help you with the prescription of detailed exercise programs. It also is to provide both feedback and motivation to keep you interested in exercising. And finally, is to help pick up or diagnose any health problems. You should also know that the risks involved in this assessment include fatigue, muscle soreness, irregular heartbeat, chest pain, or even sudden heart attack, but we have measures put in place to reduce the risk of these. You should also know that there are alternative assessments like the rock hot walk test or the 6-minute walk test. So if I have your full informed consent, please sign this consent form. Okay, thank you. Okay, so right now I need to measure your resting blood pressure and your heart rate. So now it's measuring your blood pressure and your heart rate. I will also do this after the assessments. This is to ensure a baseline reading of your heart rate and blood pressure. To ensure that after the exercise, it drops down to a stable level. So this allows us to check for hypertension, hypotension, syncope, bradycardia, and trachecardia. So according to the readings, your blood pressure and your heart rate are normal levels. Okay, so before I begin the assessment, we need to do some warm-ups. So for my warm-ups, it will be this warm-up session called 2 by 30-30. Wow. So you begin with 30 seconds of jogging on the spot, followed by 15 seconds, about 30 seconds of leg swings, side to side. So it'll be like this. And after 15 seconds, you swap to the other leg. And then immediately follow that up with 30 seconds of jogging again. And then followed by 30 seconds of leg swings, but front to back. So 15 seconds left leg. Okay, so the warm-up should be low to medium intensity, but you should feel properly warmed up after doing so. So, are you ready to perform the warm-up? Okay, let's go. 30 seconds of jogging on the spot. Start. Okay, so next will be the 30-second leg swings. Start with your left leg. So you should start slowly. Make sure the movement is controlled. And okay, next leg. Same thing. Make sure the movement is controlled and slow. Okay, so now 30 seconds jogging again. Now leg swings, front to back. Okay, remember, keep the movement nice and slow and controlled. And we're done. So if you look there are 2 poles, one here, one there. Both are 2 meters apart from each other. You will stand on the first line there, facing here. So for this entire test, you'll be instructed by an audio playing. So the running speed will initially start slowly, then it will gradually increase faster and faster. Once you hear the signal, the beep signal, then so over time you'll get faster and faster.
A single lap should be completed before you hear the beep sound. If you reach the line before the beep sounds, you have to wait until you hear the beep sound, then you can continue on. So remember to run in a straight line and run as long as possible. If the line is not reached before the beep sound, you are given a warning and must continue to run to the line. The third time you fail to reach the line before the sound, or within 2 meters, the test is over. So remember to do your best and don't push yourself to a point of overexertion or beyond that. Just do what I say for you. Also remember to breathe naturally throughout the test. Okay, so this is a demonstration for you.
Level 1, 3. Level 1, 4.
Okay, you understand? Yeah, so after that, once you perform the exercise, you'll be doing a quick and short cool-down exercise.
Start of level 1. Good. Level 1, 2. Level 3, 7. Level 3, 8. Level 10, 5. Level 10, 6. Level 10, 7.
Okay, so how are you feeling? Are you tired or unwell? Let's begin with the quick cool down session. So we'll begin with 15 seconds of seated hamstring stretch on each leg. So the left leg, try grab your ankle, and the right leg. Then followed by 15 seconds of gastrocnemius stretch. Same thing, left leg, 15 seconds, right leg, 15 seconds. Then next is the gluteus maximus stretch. So just cross your leg over for the right leg, and then hug your leg, 15 seconds, change leg, cross over, hug your leg, 15 seconds. Quadricep stretch, it should look like this. So you just grab your left leg, you can lean against the wall and hold the wall if you need, and then change to your right leg. Okay, so let's perform them. So it'll be 15 seconds of left hamstring stretch first. Okay, if you can't grab your ankle, you can grab your shin. Now let's do the left gastrocnemius stretch. Next, let's do the gluteus maximus stretch. So let's start with the right leg. So cross your right leg over and hug your leg. Okay, next will be the quadricep stretch. 15 seconds left leg. So I'll be measuring your heart rate and blood pressure to ensure that they are as close to their resting values. So according to the readings, your blood pressure and your heart rate are back to normal levels. Okay, so how are you feeling?
Wonderful.
Okay, so based on the results that you achieve a level 10.5. And using this formula, we are able to calculate your predicted VO2 max from your 20-meter shuttle run test result. So I just need you to help me fill in your details. Alright, so based on your result, you achieve a VO2 max score of 48. So based on this score, you actually fall under the category of above average for males aged 18 to 25. So according to the University of Kansas Medical Center, you have a VO2 max which is 68.6 percentile, which means in a room of 10 people, you have a high VO2 max than 6 of them. So overall, you did quite well. This is good. This is a good start, as a high VO2 max lowers the risk of heart disease, hypertension and stroke, as well as general health. And in your day-to-day life, it means you have a higher quality of life, having more energy and stamina. So some recommendations would be to build cardiorespiratory fitness for substantial health benefits. So you can do this by 150 to 300 minutes a week of moderate intensity aerobic physical activity. For example, going for a bike ride, jogging with your friends, minimally 30 minutes for 5 days a week. Or you can also do 75 minutes to 150 minutes a week of vigorous intensity aerobic physical activity. For example, running, minimally 25 minutes, 3 days a week. So another recommendation would be to build muscular strength and endurance, as it is equally important for your goals. So minimum twice weekly, 8 to 10 exercises of moderate or high intensity on 2 or more non-consecutive days using major muscle groups. Your repetitions should aim to be around 8 to 12. So for example, doing a push-pull legs gym training split. Okay, so yeah, if you're feeling well, that is all for the cardiovascular fitness assessment. You are now free to go.